One got elected with the State House, Dr. Huntley. Good to have you here, and works on public health for Minnesota and making sure Minnesota is very, very healthy. And Senator Sandy Pappas, who has been very involved internationally, and especially violence and trafficking against women. So I think it's reflected that we care all the way down to the city council level there. So. This is a good discussion, and I do want to turn it over to a discussion quickly to hear from you with some of your thoughts, some of your ideas, goals, or suggestions you might have for us. But as was pointed out, I think we sometimes take a little for granted just how interconnected we are. We don't even think about it, but we are. We're connected to the rest of the world in the 21st century. We are connected every moment of every day with the rest of the world. Any one of us could be affected by a personal health crisis in another country. Just ask your Dr. Finnegan. Ask Dr. Osterholm. Ask Dr. Craig Packard here at the University of Minnesota. And I'm going to give an example. Last year's measles epidemic. One young child from Minnesota who was not immunized. We have work to do here at home, folks, too. One child that wasn't immunized traveled to Kenya where there was an epidemic of measles. Unfortunately, he caught measles and then came home and spread it to 20 other children in Minnesota. Now, that had the potential of being a major public health crisis. And that's not unique as to what can happen even here at home. But we got on top of it right away, and we're working on it to make sure that all children in the state receive immunizations. Every year, though, thousands of Minnesotans travel to countries all over the world. So that's one of the many reasons why we should support improved global health. For no other reason than to protect the health of our own community and our own families. Stronger health systems in developing countries are becoming part of an effective, preventive healthcare system right here in Minnesota. We also care about global health because it leads to a more peaceful world. I've seen in my travels to Yemen, Sudan, and Laos, and other developing countries, this common pattern. Healthy people create healthy communities. Healthy communities help to create stable countries that reduce conflict and violence. And as taxpayers, all of us should recognize a dollar invested in the work of the State Department and USAID can save many future dollars being spent by the Pentagon. There's another reason why global health matters to Minnesotans, for most of us, and to me. Global health matters to me because of you, because the life of every child and every father matters. And I had the privilege of knowing Lois's crew when they were younger. And there's no parent that any of us have met that hasn't held their child in their arms and wished the following things for. I wish you food, I wish you shelter, I wish you love, I wish you peace and success. Every parent, that is the wish of every parent, anywhere in the world, when they hold their newborn. So we share a commitment to make sure we do all that we can to prevent disease everywhere so that we can make a difference. We are committed to fighting improved global health for our brothers and sisters in the developing world, but it's a hard fight, as Lois pointed out. But we are making progress. New vaccines are being developed that could turn the tide against some of the world's worst disease. A new malaria vaccine was named one of the most important medical breakthroughs by 2011 by Time magazine. Researchers are telling us that universal flu vaccine is within reach. And HRV, as in the affection against AIDS, has made a breakthrough. Advances in maternal child health are saving millions of lives. 3M right here at home has developed a low-cost tempura doll that can be used by healthcare workers to detect infections early. Why is this important? Think of some of the things Lois was just telling you about. This technology replaces glass and mercury thermometers that break easily. Digital thermometers are too expensive. This dot will save a life. The combination of tablets, microsubial blood tablets, is helping with the postmortem saving hemorrhaging that's going on in women's lives. The number of women that just bleed out when one tablet could save their life, for one person recognizing when to use it so that they're used sparingly and that they're used properly is huge. When a mother dies, children become orphans, and a village loses a farmer, a teacher, a mentor. It is insurmountable what we can do by saving mothers' lives in these towns. Saving lives in technology is in hard-to-reach areas. It's getting better. And it's getting better because when people decide that they want to come together to solve a problem, they can. Creative partnerships and Coca-Cola are helping to transport vaccines in the most remote villages around the world. Because as you know, and if you've traveled, you do see Coca-Cola wherever you go. The Coca-Cola company has worked with local village people to get it there, the Coke and the vaccine. So I've really seen this difference in global health advances that are making a difference in lives in families like Guatemala, Tanzania, and other countries. And progress is being made because of the Global Health Initiative, because of leaders like Lois, Quam, who go in and work in partnership, listen, learn, watch, ask, explore on what we can do to make a village health system work. We are also making huge success because of work that's done in Minnesota, and some of the folks are here today. I recognize several of you: American Refugee Committee, Global Volunteers, the Center for Victims of Torture, Welshare International. I could go on and on and on. And the religious institutions here too that play a role. We are making a difference because many of us in Minnesota, probably all of you here in this room, work or make donations to make a difference. We need to keep moving ahead on the things that are working. That's strategic of what Lois is working on. We need to keep moving forward. We need to increase focus on the basic health of everyone. And we also need to do that by focusing on clean water and adequate food and nutrition. Clean water and good nutrition are the building blocks of health. They must be the foundation of our global health programs, and they are. We have a lot to discuss, and I look forward to learning from you, and I look forward to working in collaboration with all the great institutions at the University of Minnesota. And I think it's so important that you mentioned the School of Veterinary Science. The University of Minnesota, the University of Ohio, here's a trivia question for you, and the University of Texas all have three things in common. They have public health, they have veterinary schools, and they're the last rate state fairs, ours being the best. But that's a very key integral part in why I'm so proud to represent the St. Paul campus.
All right, this is where we work the room and where you get a chance to ask questions.